Hello everyone, we're here with Miss Martha Gerong, who graduated from the University of Santo Tomas College of Nursing. She's working 2 years now, and she's currently working as an ER nurse in Sacred Heart Medical Center. She's gonna help us to know what it takes to become a nurse and to know what one has to go through in a nurse's job. So the first question is, why did you choose to take up nursing in college?
I don't know.
What?
Actually, I didn't. It wasn't my choice to take up nursing in college. I wanted to take up either journalism or psychology because I was into writing. But then, actually, I took only two university exams, UP and UST. I failed UP journalism and I failed UP journalism and psychology. So, and I passed UST nursing, and then I was what do you call this? Waitlisted for UST psychology. So it seemed like the easier way to just go with nursing. So because it was because I was already passed. I already passed it. So there you have it.
Okay, but do you have any regrets now?
I've always thought that since the educational system in the Philippines, we force our students to pick up a college degree way too early. At that time, I didn't want. I wasn't sure what I wanted. But since I was more into writing, I thought, okay, I want journalism. But now, looking back, I don't regret anything.
Okay. So the next question is, what did you feel, or what was your reaction when you found out that you passed the board exams?
I panicked, actually. No, actually, it wasn't my reaction to passing. Because the first time I looked at the list of passers, I didn't see my name, so I cried. I was about to cry, but then I scrolled down and saw my name, and I was really happy. I was speechless because, that's 4 years of your lives, of hardships, of everything you went through in nursing school, and then there you have it, you already have your license. But then I was happy but also anxious because I knew, what now? The feeling was like, what now? What happens after I pass the exam? What happens after I get my license? I didn't know because I'm the eldest, so I don't know. I don't know where I would go after that. I was anxious, but also quite happy. So it's a mixed emotions of both.
So, how hard was it to graduate from the College of Nursing?
It's an inside joke among um, among nursing students that you go through hell just to pass or just to graduate. But I think it goes for all college students.
Yeah.
Not just nursing students, but the difference, I guess, is because you're training these students to, what do you call this? To be future nurses who take care of lives, handle other people's lives. So it's more uptight, more strict.
Yeah. You can't make mistakes.
Yes, you can't make mistakes. So everything they teach you in nursing school, you realize once you go into the profession that, oh, I really needed to learn this.
Yeah.
Like you can't, what do you call this? You can't just think that, oh, I don't need this. Everything they taught you, you're gonna use it one way or another in the profession. So how hard was it? Example would be like waking up at 5 in the morning to get to your 7 a.m. duty. So duty for like 5 hours, 7 to 12. Of course, you're exhausted. You take care of patients. But then, after that, you just take like an hour break. And then you go to class. Lecture classes. So that's from 1 p.m. to 5 p.m. So that's 5 hours duty, and then right after 5 hours lecture. So imagine
Yeah.
the
It's so
hardships.
tiring.
And after that, you have to make paperwork, assignments, you study for quizzes in between. So it was hell.
So in connection with the previous question, do you have to memorize everything in the books to be able to apply it in the field? Like everything?
Probably one of my greatest regrets as a student was not memorizing. You don't have to, because when you go into the profession, there are books available on the station, but it will make your life easier if you do memorize. Like for example, the drugs, the formulas, the anatomical positions. You don't have to pause and think, oh, how do I document this? Where is the wound located? You don't you because you can't just put there's a wound on the knee. You have to put like there's a wound on the patellar area, chena. You have to use like medical terms. So you don't have to, but it will make your life easier if you do.
That's the reason why I don't like medical courses. So, in nursing, I know that you have to interact with strangers. During your first years, did you have a hard time in doing so?
I'm generally an introverted person. I not really like. I'm more of how do you explain it? Non-social?
Non-social, not antisocial.
I'm not antisocial.
Yeah.
I mean, I make friends, but I'm not really the type to go out and meet
First
a
two.
lot of people, go to parties, but what was the question?
In your first years, did you have a hard time in doing so, like interact with strangers, with patients?
It was more difficult for me. Interacting with patients was easier than interacting with your coworkers, like your nurses, your doctors, especially doctors. Interacting with patients comes like second nature because you've been doing it since you were a student. You ask them about how they feel, their symptoms, like that. So it's quite easy to establish a relationship with your patient, especially since the patient knows that you're there to help them. So they are more cooperative with you. But interacting with, for example, your co-nurses, your doctors who are who are how do you say this? Who are hard to work with.
Yeah.
That's the struggle I had. So the first hospital I went to, I actually didn't like the people there. So aside from the fact that it's so far away, I also didn't like the way the people worked, the way they interacted with each other. So that's why I quit and looked for another hospital.
You can stay when the people are not good, right?
It's not that I can't stay. I mean, you can stay.
Yeah.
You have a choice to stay, but the more of the circumstances were against me staying in that hospital. So that's why I left.
So how about interacting with the relatives of the patients?
Patient relatives or significant others are quite interacting with them is a skill also that you have to practice and learn how to. It's not because not all people are the same, so the relatives' reactions to the nurses also vary. So you don't know if this relative will like you or this relative will shout at you or something if you make a mistake. But as of now, I haven't encountered relatives who were
Rude.
aggressive or rude. There are,
They're
but
rude.
aggressive, no, not yet. Yeah, usually I just, how do I handle it? I just handle them professionally and stay calm because if you also how do you call this? Respond in kind. Like if they're rude to you and you become rude to them as well, it will only create more
Conflict?
conflict. So just stay professional about it. You get to learn as you go into your profession, into the profession of nursing. You learn how to interact with patient relatives who are rude, who are kind. That makes sense.
Yeah. And then next question is, what are the toughest parts of being a nurse for you?
Toughest parts, probably. Mm, it's a tough question. Probably the schedule, because I've experienced 12-hour duties. You wake up at 5 to go to the hospital, to be at the hospital at 7, and then you at 7 a 12-hour duty ends at 7 p.m. But once 7 p.m. comes and your coworker is not there to relieve you yet, or you haven't endorsed the patient properly yet, you can't leave at exactly 7. So probably you'll be around 7:30 to 8, or worst case scenario around 9 p.m. It's the end of your shift. So you go home. You just basically go home to go to sleep.
Don't have time
You don't
to
have
eat anymore.
time to eat anymore. You do everything, and that's what I always say. You do everything at the hospital. You eat there, you sleep at home, and then you do everything there. You eat there. Your job's there. Your friends are basically your co-workers, because you don't have time to socialize anymore. You can't go to your cousin's birthday. You can't go to Christmas.
There's no holidays.
No holidays. So I think that's the toughest part of being a nurse, is the schedule.
So what are the benefits or advantages with?
I guess being more knowledgeable about health. Because usually when you're the family nurse, everyone comes to you for advice for like sore throat, or what do I do if I have a stuffy nose. So being able to veer your family towards the healthy side is a plus. The plus side of being a nurse. What else? Also, it's rewarding. I know it's cliche, but it's rewarding to get a thank you or a nice smile, or if your patient acknowledges you after the shift. It's also one of the best feelings.
So, what kind of patients do you dislike the most?
It's a tough question. Probably the most difficult patients to encounter or to interact with are those who are non-cooperative. The ones who are non-compliant with their health. For example, there's this patient who has asthma, and then she's having difficulty breathing, and then you ask her, do you smoke? Turns out she is a smoker and has been a smoker for so long. And then she comes to the hospital and says, I can't breathe, you need to help me. How can you help someone who doesn't help themselves? That's what I always say. So I guess, I really hate patients who come to you to ask for help, and then once they're relieved, they don't help themselves.
No, they just repeat.
Yeah, they just keep repeating. They just keep coming back to you with the same problem. That's why.
So stressful.
Yeah, so stressful.
How about the ones you like? The cooperative ones.
Yeah, the cooperative ones. Those who they do everything the doctor tells them to do. The kind ones. The easy ones. Those who I really like patients who are proactive about their health. Like they ask you questions like, so what do I have to do before this, or do I take my medicine after this, like that. Those who are proactive about their their health, and those who cooperate. The best patients ever. Bonus if they give you like. Just kidding.
But do some of them give you?
Yeah, they do. Some give us like, what do you call this? Biscuits or fruits. We're not supposed to take them, but the sentiment of you wouldn't give anyone like little biscuits or fruits if you don't appreciate them, right? So
Yeah.
it's more of the sentiment of them wanting to thank us through those things rather than those things that I appreciate.
So speaking of patients also, what's the worst condition you've encountered in your nursing life?
There was this, probably one of my most memorable patients. There was a 60 plus, I think he was 69 or 68-year-old man who had cancer. He was a cancer survivor. You can't call him a cancer survivor because he just ignored it. He has this big tumor on his neck as big as his head. He ignored that for like 20 years and then came to us with difficulty of breathing. So he was quite memorable because he had all the... he was okay. He was also a baseball coach. He was a player, but then that thing came. So he became a coach. He was quite active with his life. But then he came to us with difficulty breathing because the tumor was too big. And then, what do you call this? When he got into the hospital, we found out everything was wrong with him. Like, there was something wrong with his stomach, there was something wrong with his liver, with his kidneys, everything, all the values, all those blood levels were, what do you call this? Were abnormal. So I kept thinking, how did he survive all those 22 years with that big tumor on his neck and all those blood levels abnormal? And then come to us 22 years later with difficulty of breathing. So that was probably the most mind-boggling case I've had.
What happened then?
He was, I don't know what do you call this? He had a lot of surgeries done. So they had to remove part of his intestines. So you feed him through a tube. What do you call this? To help him breathe better, they put a hole here. They call that tracheostomy. So they had to put a hole here to help him breathe better. There was a tube here so that he could eat. There was also a tube placed inside his penis so he could pee. There were tubes everywhere, and then there were IV lines, and then that big tumor. Actually, by the end, I think the relatives were just what do you call this? Debating whether they should have it off, but the patient didn't want it removed because he lived 22 years with it.
Attached.
Yeah, he was quite attached to the little
Literally.
monster. Kidding. Yeah, but that was the most mind-boggling case because how do you live with cancer for 22 years? Well, there are other patients who get diagnosed with cancer and then a month later they die, right? So, I guess so.
So what cancer was it? Cancer and...
It was initially nasopharyngeal cancer here. That grew, the tumor grew, and then there were metastases. That's what you call cancer that's transferred in other parts of your body. So he had problems with his intestine, he had problems with his stomach, he had problems with his liver. Yeah, it traveled through his blood. Yeah, it spread. Traveled through his blood. And I think at one point he was just exhausted about everything. But he was still able to go home. And then he died there. I think that was my memorable and mind-boggling case ever. Also quite memorable because never mind.
Why?
No, because there was an instance he was what do you call this? He had a hole here. That's what we call a tracheostomy. And then he had really thick secretions, so you need to suction it out so that he could breathe better. But then my coworker didn't tell me you're not supposed to put, because usually when you suction, you put the tube like halfway or 3/4 way in, and then you suction it out. But since that patient was having trouble breathing, you're supposed to just put like, and he opted. Actually, it's the patient's choice that only just like this long of the tube was supposed to be put in when you're suctioning. And the nurse didn't tell me, my coworker didn't tell me. So he was having trouble breathing. So as a rescue attempt, I wanted to suction out all the secretions. So I put in like 3/4 of the tube. And then the next day, I was told I wasn't allowed to suction him anymore because apparently I was killing him. But I wasn't killing him. I was trying to help him.
Yeah.
It was just it was just that my coworker forgot to tell me that the patient doesn't want the tube that deep inside him. I think that's why he was memorable as well. But aside from that, the 22 years.
Yeah. I think it's memorable for me too.
Why? What?
It's a miracle.
Yeah.
It's almost a miracle. And the, what you call it? The experience, your experience. It's so, what do you call that? Pressuring.
Pressure.
Yeah.
Yeah.
It's like, if you're a nurse, you're in a lot of pressure.
Yeah.
Because
But you learn
it's
to deal with
someone's
that.
life.
Yeah, it's someone's life you're dealing with. I mean, look, specifically for that situation, I wanted to help the patient, but it seemed like the patient viewed it like I was killing him. But all in the day's work.
So, for last question, what can you say about our country's treatment to nurses like you?
Actually, if you're a nurse, you feel that people look up to you because you know things about,
Health.
health in general, or about medications, about illnesses like that. So you feel like people look up to you because in the hospital setting, when you interact with patients and with relatives, they usually come to you for help, or if they have any questions about their medications, they don't ask the doctor, they ask the nurses. So it feels like they look up to you. But then you go through social media and see all these posts about how other people view nurses as helpers of the doctors. I'm not annoyed because I know that those people don't know what it's like to be in my situation or in my profession. So I guess more empowerment is needed, or we need to educate the people more about what nurses do in real life. And then what else? I guess compensation is an issue now because in the law it states that nurses are supposed to get 25,000 a month. I'm not after the money. I'm after more of, how do you say this? Quite tough.
Getting what you deserve?
Yeah, getting what you deserve, or giving the nurses what they are due, because they're nurses. Being a nurse is a tough job, and then to get less than what you deserve after all the things that you do for your patient is kind of unfair. Although I do understand the side of the hospitals, especially with how messed up the medical field is in the Philippines. I do understand where they're coming from. I just hope they find like a nice even ground where the nurses are compensated well as the hospitals are able to provide proper, how do you call this? Provide patients with better or acceptable facilities.
I hope
Did I make
someday.
sense?
Yeah. I hope
It's
someday.
difficult to say your opinion about that matter because it's not just problems of the hospitals and the nurses. That it's not just the hospitals and the nurses that created the problem. It's the way the entire country works or the entire country's health system works that needs to change. So tough situation.
Duterte, if you're watching this,
Please.
joke. Kidding. So that's it. That's the last question, and thank you for your time.
I hope I made sense.
Yeah.
I think half the time I was just babbling.
You actually answered really
Most
well.
of the questions.
Yeah. All of the questions. And
Actually, I want to say more, but
you've learned enough.
you've learned enough. No,
And-
actually, you've learned just like the tip of the iceberg. You haven't even seen what really goes on within the nursing profession. But thank you for having me.
Thank you for your wisdom and time. So there you have it. You know what it takes to become a nurse and what they go through. A glimpse of it.
What it takes to become a nurse.
What?
What does it take to become a nurse?
It takes perseverance,
Patience.
patience.
Patient.
Okay. That's all, everyone. Bye.